One of the most important ways of preventing contamination and the spread of bacteria is through healthcare workers maintaining hand hygiene. This can be achieved through a routine hand wash lasting 15 to 20 seconds that cleans the hands thoroughly. The hands should be saturated with water before applying soap and thoroughly scrubbing all surfaces of the hands and nails. Blood pressure is taken to establish the pressure of the blood force pushing against the walls of the arteries. Blood pressure is at its highest when the heart contracts, pumping the blood. This is called the systolic pressure. When the heart is at rest between contractions, your blood pressure falls. This is the diastolic pressure. Blood pressure can be recorded by a sphygmomanometer, also known as a blood pressure monitor. The blood pressure monitor allows for visual and auditory indicators that give the systolic and diastolic blood pressures. Temperature recording gives an indication of core body temperature, which is normally tightly controlled through thermoregulation. Temperature affects the rate of chemical reactions, so it is kept under relatively tight control. Temperature can be recorded to identify whether there are abnormal core body temperatures in a patient, which could be caused by illness. The pulse is the physical expansion of the artery that occurs as each wave of blood is pumped by the contraction of the heart. The pulse is recorded as a rate and is usually measured in the wrist from the radial artery. The pulse is recorded as beats per minute. Respiratory rate is the inhale-exhale cycle of the respiratory system, which is recorded as a rate as breaths per minute.
Hello, my name is Angela Loomis, and in this presentation I will be talking about occupational exposures to bloodborne pathogens. Where are bloodborne pathogens found? Bloodborne pathogens are found in many occupations. Predominantly they are found in hospitals, doctors' offices, dentists, many healthcare occupations, tattoo parlors, and law enforcement. Occupational exposures. Workers in healthcare fields are predominantly exposed to bloodborne pathogens, more so than most occupations. These exposures can be from needle sticks, any contact with blood through mucous membranes, contact through open sores and cuts, and several other ways. What are bloodborne pathogens? Bloodborne pathogens are pathogenic microorganisms that are present in human blood and can cause disease in humans. These pathogens include the human immunodeficiency virus, also known as HIV, hepatitis C and hepatitis B, which will be referred to as Hep B and Hep C, syphilis, and viral hemorrhagic fever, also known as Ebola or the Marburg virus. Every day, hundreds of healthcare workers are exposed to bloodborne pathogens. Many of these exposures are not classified as significant exposures, which, with most cases, not resulting in the healthcare worker acquiring the disease, which with they may have been infected or exposed to. In a 6-year study that was conducted, the following results were found. 230 exposures were reported, 140 were considered significant. Needle and syringe assemblies accounted for 59% of the exposures. Butterfly needles or lancets accounted for 8% of the exposures. And of the 230 exposed, 77 were exposed to HIV, and only 27 of these were considered significant. How is a risk determined? A risk is determined by two factors: the type of bloodborne pathogen that the worker was exposed to, and the route of exposure. Certain types of pathogens that occupational workers are exposed to are hepatitis B, which there's a 1 in 3 chance of acquiring this with the source known. Hepatitis B, a 1 in 30 chance with the source unknown. hepatitis C, a 1 in 30 to a 1 in 100 chance of acquiring this, and HIV with a 1 in 300 chance of acquiring this pathogen. Also, the risk is determined by the route of exposure. The needle size, a larger gauge is riskier than a smaller gauge needle. The needle type, a hollow, being riskier than a solid needle. The needle with syringe of fluid, which is riskier than a needle alone. A deep puncture fluid rejection, being riskier than a deep puncture without fluid. Riskier than a superficial puncture, which is riskier than a superficial scratch with bleeding. Which is riskier than a mucous membrane exposure, which is riskier than a non-intact skin exposure, which is riskier than just the aerosol of blood exposure. In a study that was conducted from 16,922 healthcare workers exposed to blood in the occupation, out of these 16,922 healthcare workers exposed to the bloodborne pathogens, clerical workers were exposed 1% of the time, dental workers also 1% of the time, housekeeping and maintenance were exposed 3% of the time, and student help, such as those on internships and volunteers, were exposed 4% of the time. Other workers were exposed 5% of the time. Technicians were exposed 15% of the time. Physicians were exposed 28% of the time, and nurses were exposed 44% of the time to bloodborne pathogens. In conclusion, the risk of acquiring HIV and other bloodborne diseases through occupational exposure is very low, and the risk of acquiring these diseases can be further reduced by adopting safer work practices. Some recommendations should be using all personal protective equipment properly and the correct personal protective equipment, covering all open sores and wounds when working with patients or in an area where bloodborne pathogens may be present, using self-sheathing needles, proper needle capping techniques, and proper disposal of needles into appropriate sharps containers.
Okay, I want you to don and remove the gown and gloves. Okay. Take your turn. Wash my hands.
Miss Bennett, you need to use the bedpan?
Yes.
Already washed my hands and put the gloves on. particularly like purple gloves, don't you? Of course, they remind me of Easter. Okay. I want you to raise your hips for me when I get ready. Okay. I'm going to put this up under your hips. Ready? Ready? Let me make sure that you're on it. All right. Now, wash your hands. Raise the head of the bed. You can get it. Great. Perfect. Okay, good. Here is tissue and hand wipes and hands afterwards. Thank you. And call me when you're ready. All done? Did you bounce move or did you just tinkle? I just tinkled. Gave me a good amount there. That's good. Let me go measure this and or empty this and I'll be right back. Okay. Area. Wash my hands. Give you a collar and
Okay, your first procedure will be applying one knee-high elastic stocking at head hose. Okay?
Ms. Bennett, put a little stocking on your leg today. Get your toes out here where I can see good. Over your toes. Oops, sorry. Now, feel okay? Not too tight? All right. And you can do your call bell right here. And I'll wash my hands.
All right, Kathy, I want you to go in and feed a client who cannot feed herself. Okay.
Hi, Miss Adams. How are you? I've got your lunch. Are you hungry? Not at all? All right. Tell me your name. Kathy Adams, that's right. And I've got a regular diet for you. Miss Adams, I'm going to lift your head up a little bit more. I want you sitting up pretty straight to eat. Are you feeling better today? A little bit? Okay. I'm going to wash your hands. Maybe after you eat, you'll feel a little bit stronger. Okay? Put this over your pretty gown. So you won't get anything messed up, okay? I'm just going to lay it on you. Alright? You get your bedside table over here. We have a chair. Okay. Well, Miss Adams, we have some nuts, full of protein. That should make you feel real good. And I have some mandarin oranges and a nice beverage. It looks like first. Okay, would you like a drink first? How's that? Would you like a bite of orange or nuts first? Orange. Here you go. Did you get it swallowed down? Mm-hmm. Okay. Have another bite and then we'll have a drink. Okay? Did you get it swallowed down? Okay. Here's your another drink. Would you like a bite of nuts now? Here's the cashew. It's a beautiful day outside. Maybe after a while we can get in a wheelchair and I'll take you for a ride. Sound good? Maybe if you feel better. Here's another drink. Would you like another bite? You done? Are you sure? Okay. I'll leave this out. Let's get you all right. And your hands didn't get dirty, but I'm going to go ahead and wipe them off real quick, okay? And here's your call light. You want me to put your bed down a little bit? And tell me when. That's good? Alright. I'm going to go and put this stuff where it belongs and wash my hands. So I'll be back. If you need me, holler. Thank you.
Kathy, I want you to go and provide mouth care for your patient, please.
Hi, Miss Bennett.
Hi.
It's Kathy. I'm going to do some mouth care this morning. Brush your teeth. Get you all fixed up for the day. Is that all right?
That's fine.
I'm going to raise your bed up a little so you'll be sitting up straight for me. Did you have a good breakfast this morning?
It was pretty good. Thank you.
Did you eat it all?
Yes.
Good. It's about time. You've been eating very well. I'm glad to see you doing it.
My eyes been bothering me.
Let me put this towel right here so I don't make a mess. You like a little bit or a lot?
Just a little.
Open your mouth and let me do your tongue. Just a count one.
Mm-hmm.
Sometimes we kind of get it away from the mouth. Okay. A little water.
Thank you.
A little water.
That's good. Thank you.
Got a little bit of toothpaste. Now, how about we put a little bit of ointment on your lips? Can I do anything else for you right now?
No.
Okay. You got your call bell. You got your call bell. I'm going to clean up my mess. And if you need me, you call.
Thank
Okay?
you. Your next skill is denture care.
Miss Adams, I would like you to provide fingernail care on one hand.
Hi, Miss Briley. Hello. It's Kathy. I'll do a little fingernail care today. If that's all. Good. Just kind of sort of suck your fingers so I can just get your nails, okay? Before we get started, though, I want you to put a finger in the water and just check the temperature. Let me know if it's too hot or too cold. Is that good? Now, let's just sew those fingers right there. Just a minute. After we finish, we can polish your nails if you like.
Well, that'll be good.
Okay. Alright. Got some pretty fingernails.
Thank you.
You're welcome. Pretty rings too. Okay, let's dry it off a little bit. Now let me just check and see if anything needs to be filed. Got any rough edges? Just a bit. Okay. How does that feel?
That's good.
Is that good?
That's real good.
Okay. And I'm going to go clean up my mess. And if you need me, you call me. Okay? Thank you.
Thank you.
Come in.
Hi, Mr. Smith. My name's Elizabeth. I'll be your CNA today. Come to do your foot care. Is that okay?
Yes.
Okay, I'll be right back. I just need to wash my hands first. Wash hands. Close your curtain for privacy. And gather my equipment. How you doing today?
Good. Good. Not bad.
Great. I'll be right back. I'm going to get some warm water.
Okay.
Did you eat breakfast today?
I did.
How was it?
I ate more than I did yesterday.
Well, that's good. They have a new cook.
Well,
Maybe that's why.
pretty good this morning.
Okay, tell me how's the water.
Oh, that's fine.
Oh, good. Okay, and we'll lift your foot. Just wash it real good. Get between your toes, real good. How's that feel? Nice?
Yeah, it's very good.
Good. Get the salt from between your toes. Put your foot down there.
Okay.
Dry it between your toes real good. Back up.
That feels good, thank you.
Oh, you're welcome. Don't want to get any lotion between your toes. Just kind of do a little rub. There you go.
Thank you.
Just put your foot back in your shoe. There you go. Push. You comfortable?
I am, thank you.
You're welcome. Well, I'll be right back. I'm just going to clean this up. Empty, rinse. Dry. Disinfect. Here's your call bell.
Thank
If you need me for anything, I need you to push the button, okay? And I'll come back.
Okay.
Are you comfortable?
I am.
Would you like some water before I go?
No, I'm okay.
You sure?
Yes.
Okay, well, I'll see you later then. Open curtain and wash hands last.
Body mechanics uses alignment, balance, and correct posture when lifting, moving, or bending. Body positioning is used to prevent contractures, promote optimal joint movement, and to prevent injury due to improper movement or immobility. To complete this exercise, you will need a hospital bed, a wheelchair, pillows, towels, and blankets for positioning, 2 assistants or lab partners, and a mannequin. To move a client up in bed, position the head of the bed so that the client is laying as flat as possible. Then raise the bed to a comfortable working position. Place the pillow at the head of the bed. Then ask the client to flex their knees and cross their arms over their chest. With one nurse on each side of the bed, roll up the sides of the draw sheet as close as possible to the client. Then, on the count of 3, instruct the client to lift their head and push with their feet. At the same time, both nurses will lift the draw sheet and the client will be repositioned to the head of the bed. Finally, replace the pillow, covers, and adjust the bed so that the client is comfortable. To transfer a client from a bed to a wheelchair involves 2 steps. Begin by positioning the wheelchair and locking the wheels. Then ask the client to flex their legs and turn towards you. Stand with the wide base, then place one arm under the client's shoulder and the other under both thighs near the backs of the knees. Lift and pivot the client to a sitting position and make sure that they are stable. The next step will be to transfer the client from the bed to the wheelchair. Begin by instructing the client to place their arm on your shoulder. Reach around the client's back and lift them off the bed. Position the client to the edge of the wheelchair, then instruct them to grasp the chair's handrail. Slowly lower the client into the chair, then position the client's feet onto the footrests. To log roll a client, it is recommended that there are 3 nurses. Position nurse 1 and 2 on the sides of the bed that the client will be facing and nurse 3 on the other. Place a pillow between the client's legs to keep proper alignment. On the count of 3, the 2 nurses will support the alignment of the head and legs, while the third nurse pulls the draw sheet to roll the client. Place the pillows behind the client's back and adjust the pillow between the client's legs. Finally, instruct the client to lean back on the pillow for support.
Morning, Miss Duncan. Good morning. How are you feeling this morning? Okay. How about we change your position just a little bit? Okay. All right. Put your head down. Pull this side rail up. Roll the lever this way. Now, first thing I'm going to do is pull you over toward me just a little bit, okay? I'm going to start with your shoulders. A little bit here. Get your hips. Okay. Legs. All right. Now, this side. And this arm up. And this arm. And start rolling. Reach for the side rail. Okay. Are you ready? Okay. Here we go. 1, 2, 3. Okay. Forward, back. Lean back a little bit better. Okay, on between your knees. Shoulder out. Now, you want this arm down or up? Right here. And your hips are a little crooked. Pull your hips out just a little bit. How's that? Good. One more thing though. I'm going to make sure your ankles Would you like your head up just a little bit now? Yes, please. Good. Okay.
Kathy, I need you to provide passive range of motion for one shoulder.
Come in, Miss Duncan. I'd like to do a little exercise rise to your shoulder, if that's all right with you. Okay. I'm going to raise the bed up just a little bit. Get to you very well. Now, let's do this on here. Out this way. And back in. 2, 3. And let me know. Okay. All right so far? Okay. I'll do those down here. 1, 2.
Your next skill is to do range and motion of one knee and one ankle.
Okay. Miss Adams, I'm Kathy, and I'm your NA today, and I'm going to do range of motion to your knee and your ankle. Is that okay? Mm-hmm. All right. Mm-hmm. Okay, I'm going to go ahead and lift your bed up a little bit because I'm tall. And I'm going to provide some privacy. Okay. I'm just going to expose this leg. Okay. And you let me know if you feel any discomfort, okay? All right, here we go. 1, 2, 3. How was that? Good? Okay. Now we're going to do your ankle. 1, 2, and 3. Okay, how was that? All right, let me bring that bed down. And right here's your call light. Okay. And you let me know if you need anything. I'm going to go wash my hands. Thank you.
Assist to ambulate using a gait belt.
Hi, Miss Dill. Hello. I'm going to take you for a walk today. Oh, is that okay? Yes, that'll be fine. Okay, I need to lower your bed so that your feet can touch the floor. With your feet. Okay. And then to the side of the bed. And this is to help you hold you up. Too tight for you, is it? I'm going to help lift you up. On 3. You can hold my shoulders. 1, 2, 3. We're going to walk this way. Good. Sit you right back down in bed. 2, 3. Then lay you back down in bed. Take your shoes off. 1, 2. Lower your head. Lower your head. And here's your call button. And there you are. Thank you.
Okay, Kathy, I want you to go and dress a client with an affected right arm.
Miss Adams, hey, I'm going to get you dressed. Would you like to wear the orange striped shirt or the other shirt?
I want that one.
Okay, good choice. All right. Move that up there. Whoops. Okay. Let's sit you up a little bit, okay? Is that comfortable? Okay. Let me help you get up here so I can tell. All right, go ahead and lay back in for a second. All right. I'm going to start with this arm over here and take this off, okay? This is your affected arm. All right. Let's go ahead and take that one off. And then you gently hold this one. Does that feel all right?
Mm-hmm.
Snip that off. Okay? Get your shirt ready. Look at this here. I'm going to gently pull this on, okay? Is that all right? Yep. There we go. Get this hand up here. Okay? There you go. All right, let me make sure it's straight back there. Okay, go ahead and lay down. All right, almost. Get your buttons buttoned.
I like this shirt.
Do you like it? It is very pretty.
I have a couple pants to match it.
Do you? Would you like to put those on?
No, too hot.
Now let me get this other one off. Okay. Does that feel good? Okay. Is your bed comfortable?
It is.
Let me get your car light for you. And I'm going to go put this in the dirty clothes and wash my hands.
Making an occupied bed. First step is to gather all needed items, sheets, incontinence pad, gloves, etc. Next, adjust bed to a comfortable working position. Lower the head of the bed and make sure the rail opposite you is raised. Then loosen the top linens at the foot of the bed. Check to be certain the side rail opposite you is up and ask the patient to roll onto their side facing away from you. If the patient is unable to assist, ask another person to help you roll the patient to the opposite side. Loosen the bottom sheets and roll them towards the patient. At this time, clean, disinfect, and thoroughly dry the exposed mattress if soiled. Apply clean linens to the exposed side of the mattress. To do this, first place the center crease of the linens lengthwise along the center of the mattress and fan fold the other half towards the patient. If using an incontinence pad, place it between the knees and the middle of the back. Ask the patient to roll towards you and remain positioned on their side facing you. Explain that the patient will feel a bump as he or she rolls over the center of the bed. Raise the bed rail on your side of the bed and lower the opposite side's bed rail. Then loosen the linens and remove them by folding them into a bundle with the soiled side facing inward. Place them in a hamper. Clean, disinfect, and thoroughly dry the exposed mattress if soiled. Straighten the linens starting with the sheet and then the incontinence pad. Roll the patient onto his or her back. Finish making the rest of the bed starting with a flat sheet and finishing with the bedspread. Lower the bed rails as instructed by the care plan and adjust the bed to a comfortable position.
Shoot.
Now I would like for you to provide catheter care for a female.
And gloves, laundry, washcloth,
Okay, 105 degrees.
Hi, Ms. Jones. I'm Jane. I'm going to be your nursing assistant today. I'm going to do catheter care on you, if that's okay. Could I check your name, Dan, and just be sure that you are who I think you are? Thank you. Jones, I'm going to pull this sheet back just a little bit. And hold your top up so that I can see your tube here. And all I'm going to do is clean around your tube today.
Put this pad down underneath so we won't get your bed wet.
The temperature of the water. Okay, is that all right?
It feels fine.
All right, I'm going to wash it. Just the tube. Then I'm going to rinse it. Now I'm going to dry. Okay. And we do that so that you won't get an infection down there. I'm going to take this pad out from underneath you. I'm going to go clean up my mess. And here's your call bell. Do you need anything else, or is everything okay? All right.
Alert! Before using a fire extinguisher, ensure that someone notifies the fire department, alerts others about the fire, begins evacuating others from the premises. Fire extinguishers are for controlling small fires before they have a chance to spread. Before using one, make sure that you have a clear escape, you are familiar with the operating instructions of the fire extinguisher, and that the fire extinguisher you have is suitable for the fire you're facing. Before using the extinguisher on a fire, look at the fire class symbols on the front label to make sure the extinguisher you have is suitable for the type of fire you're facing. The most common classes of fires are A, B, C, and K. Class A fires involve common combustibles like wood, paper, and tires. Class B fires involve flammable liquids like gasoline and petroleum oil. Class C ratings involve energized equipment or things that are plugged in, like appliances, computers, televisions, and electric machinery. Class K fires involve cooking oils and greases, like vegetable fats. Once you've determined that the extinguisher is the correct type for the hazard, proceed to operate the extinguisher using the pass technique to control and extinguish the fire. First, hold the extinguisher upright and pull the pin. Next, stand 8 to 10 feet from the fire and aim the nozzle at the base of the fire. Do not get too close or aim the nozzle too high. Once the nozzle is aimed at the base of the fire, squeeze the levers together to begin discharge of the fire extinguishing agent. Maintain your distance from the fire and sweep the nozzle from side to side, sweeping 3 to 6 inches beyond the right and left edges of the fire. Discharge the extinguisher until contents are exhausted to prevent reignition. Move around the fire to confirm it is completely extinguished. Your quick action can save lives and protect property. Using the fire extinguisher properly is only one part of a fire safety plan. For more information and training videos, go to www.femalifesafety.org.